Hello, I'm Dr. Kelly Gardner. I'm a psychiatric mental health nurse practitioner, ANCC board certified psychiatric clinical nurse specialist. I have a PhD in public health. I'm here to talk to you about a topic that kind of goes along with another video that I have out. It's called, Is Your Patient a Pedophile or Do They Have FLS? This is kind of part two of that video. It's called, Is Your Patient Lazy, Oppositional, or Do They Have Frontal Lobe Syndrome, FLS? First, let me explain what FLS is. The frontal part of your brain, the forehead area, has to do with executive function, meaning that if you have to go brush your teeth, you don't just go brush your teeth. It's not that simple. You actually have to go in there, wet the toothbrush, put the toothpaste on it, wet it again, make sure you do every part of your mouth, and then rinse it, spit it out, put the toothpaste back where it belongs after putting the cap on. That's a multi-step process that we take for granted because our executive function works pretty good for most of us, and we just go in there and we do it. For some people with frontal lobe changes in the forehead area of the brain, it's not that simple. So a lot of these people are inappropriately labeled as lazy. A lot of community mental health agencies use the stages of change model of care. I love that. I use that in my PhD dissertation. However, what people don't understand is if you have frontal lobe syndrome, unmotivated type, it's not your fault that you're not progressing through the stages of change to create positive change in your life and get things done. And a lot of staff members I've seen label people, well, he's oppositional. You know, I told him to see a dentist. I even got him the appointment and he never went. He's just oppositional. It isn't that. And that's why I'm putting this video out. Because these people are misunderstood. They need help. They need your help. They need someone to help them complete each step. And they're not doing this on purpose or to be oppositional or defiant or lazy. And it's important that you know the difference. Now, what causes frontal lobe syndrome? Head injuries to the frontal part of the brain. Also, your brain can bounce backwards to forward. You know, car accidents, the head hits the thing and bounces back, then bounces forward again. Also, serious and persistent mental illness causes brain changes with vascularization, plaque formation, microvascular changes. Some people have it since birth. They're born that way, where the frontal lobe isn't functioning as it should. Sometimes we don't know the cause, but the people have the symptoms. So they do need to see a neurologist to find out and get some neuropsych testing done from a psychologist to look into this so that we can get proper treatment. So if there is any brain thing going on, we're making sure it's nothing progressive. And then we can for sure identify and help this person and create behavior modification plans or treatment plans that best help these people. If they're living in a group home or AFC home, yeah, staff can help them with the different steps and not label them as lazy or give up on them. All right, here's an example, okay, of a typical person with frontal lobe syndrome. All right, hey, Sally, can you do me a favor and wash the floor, the kitchen floor? Sweep it and then wash it. So you get her all the supplies and everything. She cleans the kitchen. She says, yeah, I go into the room and Sally's watching TV. I look. She never moved the table and chairs. She just mopped around them. That's typical right there for frontal lobe syndrome. They weren't being lazy. They just were clueless. Here's another one. If the shade is pulled down a little bit from the window and you ask someone to wash the window, I'll say like, Brian, would you mind washing the window? Here's the Windex and a paper towel. Well, Brian will do the part that he sees and not realize that he needs to go up under where the shade covers. So then he thinks he's done. He's off doing something else. He thinks he did a good job. And then you come back and it's like, what the heck? So with some of these people, you just want to say, I'm just going to do it myself. It's easier. But no, that's not the way to handle it. So you get the idea. Some of the other patients that I've had with this, they smell. But then you find out that when they take a shower, they don't use soap. Or they forget to clean under their underarms, that type of thing, or they forget to add the deodorant after they get out of the shower. It's all the multi-step processes that people miss. So it's not their fault. They need some help with things, and they need a lot of praise so that they don't feel bad about themselves. Because usually you have some joker staff person or family member that labels them as lazy or oppositional or, stupid. And that's really sad. And that's why it's important that you understand this information I'm giving you today. Another thing is with like dental and doctor appointments. Sure, you can ask somebody to go see a dentist every 6 months, and then you see them and they never go and their teeth are rotting. Why? It's because they need someone actually to make the appointment, get it set up, call them the day before, pick them up and take them to the appointment. Same thing with medical appointments. A lot of things like women, their mammograms are ordered, different tests. They never follow through on anything that the doctors recommend. And that's pretty sad. That's why certain healthcare models are set up to help people follow through with preventative healthcare and getting things done if they have frontal lobe syndrome. Now, what can be done to help these people? First of all, I want you to understand that this is a neurological condition, that they are not lazy or oppositional or defiant. It is not their fault. It's due to brain changes. Next, have a sense of humor about it. Don't yell at the person or be angry. Just, oh my gosh, have a sense of humor. Give them lots of praise for the tasks that they do accomplish. The other thing you need to do is possibly, if the person's in an AFC home or whatever, you need definitely, the person needs to see a neurologist for MRI of the brain and an EEG. You also, to find out why this happened and what the cause is, and just to make sure we know what's going on. Neuropsych testing is also helpful if you get a PhD psychologist to do the testing. If the person's on Medicaid, you can call around, find somebody who does testing, get them tested, and attention, frontal lobe. And you want to check IQ as well, that type of thing, with recommendations. Always add with recommendations on your prescription for neuropsych testing. That way they'll put some recommendations for staff or family or loved ones to know how to help these people. Again, you want to make sure that you help them with things. Occupational therapists, if you can get an occupational therapist in there to help them out, they have different tools, and that's what they're trained and skilled at, is giving people tools to accomplish tasks, things that they can remember to get things done. They'll make lists, they'll put boards up, sticky notes on walls, that type of thing. So if you could ever get an occupational therapist consultation with the person, I think that would be a really, really big help. I mentioned keeping a sense of humor. And remember too, if the person has Medicaid, if family members are taking care of these people, they can get chore provider pay in most cases. If you go to my website, I have the chore provider form and how to get help get paid to care for your loved one, so that you help family members out, because they have a lot on their plate as it is, I'm sure, and then trying to help this person as well. So check out the chore provider or home help services. I list it on my website. I also have a handout on there that explains this condition to family members, staff members, even the person that might have it, if you feel comfortable doing so. You can print that off for free on my website. Overall, I hope that this helped you. And remember to give praise and help other people that know this person or that work with them to know that it's not their fault. They're not lazy. They're not oppositional. If you're using the stages of change model, motivation interviewing isn't going to get you very far. So you need to help this person and get someone assigned and or paid family member or somebody through DHS to help them complete the tasks that they need to get done to lead a healthy and productive life. I hope you enjoyed this. And remember, check out the other FLS type, sexually inappropriate type. There's a little video on that too, so that those people aren't misunderstood as mistaken for pedophiles. Big difference here. Hope you enjoyed this video. Take care. Bye.